Hi folks, I'm Dr. Michael Jones, president of the Medical Exercise Training Institute. And back in 1994, myself and another physical therapist started and developed the Medical Exercise Specialist certification. Yes, that was 25 years ago. Back then, the concept was based on post-rehab fitness. It's now evolved to medical exercise training. And in a series of videos, we want to explain what medical exercise training is, this new modality. Back in the early 1990s, we saw a consistent trend amongst insurance carriers that they were cutting back on the number of services and sessions they reimbursed for physical therapy. We realized that we needed to train the fitness professional to effectively manage patients once we discharged them from physical therapy. And these fitness professionals needed to have a very good understanding of the anatomy and pathology and the exercise management of these various conditions. Because we realized once we discharged them, the insurance carriers weren't going to authorize more physical therapy. So that started the medical exercise specialists and the post-rehab movement back in 1994. And as I said before, it's now evolved to medical exercise training. So we're going to use a series of videos to explain what medical exercise training is, this new modality. So if you would, let me take a few moments here of your time and explain a little bit more. What is medical exercise training, or MET? It's the development of safe and effective exercise programming for individuals with medical conditions. There are three essential modalities here: cardiovascular training, strength training, and flexibility training. And it's all based on a series of medically based exercise protocols we developed with the first course, and now it's evolved over the last 25 years to 60 plus medical exercise training protocols that forms the basis of what all of our medical exercise specialists, post-rehab conditioning specialists, and medical exercise program directors do. Back in 2012, to give our certified members some distinction in the marketplace, we developed a specific logo, what we call the Universal Medical Exercise Training logo, for them to display on their correspondence, their business cards, and etc. This logo depicts strength training, cardiovascular training, flexibility training, and also indicates the stethoscope, indicating that we're using exercise to manage medical conditions, not to treat medical conditions, and not to do anything that normally would be provided by a licensed physician, physical therapist, or chiropractor, but offering that next level of care when these individuals have discharged. Now, we understand that insurance carriers are cutting back on the number of services they're reimbursing for. So this has become a reality, and the need for medical exercise training will grow exponentially over the next 2 decades. With that, this new modality, let me give you a little bit more detail, is the development of safe and effective, structured, protocol-based exercise programming for specific conditions. The protocols, the exercise protocols, are not designed for general conditions, but specific conditions. And it's only exercise. There's no treatment involved. This modality also focuses on strength, flexibility, endurance, balance, and stability training. And it also is beneficial to cardiovascular, neurologic, metabolic, and musculoskeletal disorders. It uses functional outcome measures to determine the effectiveness of exercise. And this is vitally important. In the past, with exercise and fitness, it was really based on the idea of the client feeling better, having more energy, and losing weight. But if we truly want to collaborate and work with medical professionals, then we have to now start utilizing these functional outcome measures that are universally understood by medical professionals, the fitness industry, and even insurance carriers, that now allow us to say the exercise is actually producing a benefit by utilizing these functional outcome measures. Now, one key thing I've mentioned before, I want to mention again: medical exercise training does not provide any aspect of medical diagnosis or treatment. It's not to take the place of a licensed medical professional, but it's to augment the services provided by the licensed medical professional. Because as we know, the changes we're seeing with the health insurance industry are probably here to stay. Now, with that, if you want to get more information on our medical exercise training certifications, please go over to medicalexercisetraininginstitute.com. We have a series of videos that will explain medical exercise training, and we invite you to come back and watch the next video. Thank you for taking the time to watch this, and to all of our medical exercise professionals out there, we wish you the best in building your medical exercise training practice. To all the medical professionals out there, there actually is a new group of fitness professionals that are now emerging that are trained to help you manage these individuals that have chronic conditions, because we realize they are very difficult to manage. We realize they take up a lot of time and a lot of resources, and we realize they're having an enormous impact on our healthcare system. So thank you for watching. We'll see you in the next video. All the best.